I'm about to put y'all on game because all the kids be like, oh, get mango ice, get this. Stop with all that. Get you this right here. This is albuterol sulfate. Changed my life. Like y'all was just really breathing like this, like like it was.
All right, let's talk about albuterol. When you got something called bronchospasm, your airways go from looking like this to looking like that. We call this whole thing bronchoconstriction. See, there's a lot of mucus in there, gunk, and it closed off. The goal of any inhaler when you have asthma, bronchitis, or bronchoconstriction is to get your airway to look like that again. The problem with that is that it decreases the velocity of the airflow. So when you need air, you can't get it in fast enough and you can't get it out fast enough. Therefore, you feel short of breath, like you can't breathe. So when you take a puff of the albuterol, you go ahead and you relax those airways and suddenly you can breathe again. We call these type of inhalers like albuterol short-acting beta agonists. Essentially, they're activating a part of the nervous system called the sympathetic nervous system. This is the same part of the nervous system that would open up your lungs if you were running away from a dinosaur. This is why the side effects of albuterol include increasing your heart rate. You might feel jittery. Luckily, the jitteriness and the headache and the increased heart rate are usually short-lived. So you have a few options on how to take your albuterol. Option 1 is a typical pump, what we call an HFA. Essentially, you shake it, breathe out, puff, hold your breath. That's it. You can usually use this every 4 to 6 hours as needed. Because that requires some coordination, there's also a powder version. This one you just open up, breathe out, put it in, and suck the powder in. This one's harder to accidentally swallow because you have to create a negative pressure to get this one in. But this one tends to be a little bit more expensive. But this is better for somebody with bad arthritis, things like that where they can't coordinate the movement well. If you've ever seen this before, this is called a nebulizer, where you put liquid albuterol in here, and then you turn this on, and it turns into a gas that you can just inhale very passively. This one's a recommended way for doing it for kids because they can't really coordinate that inhaler that well. It's also really good for adults because you tend to get about 7 to 10 times the dose by doing this, and it's a lot more passive. The only problem is sometimes there's portable devices, but usually you have to plug it in. You would need to get a prescription of the vials like this from your doctor, and you pick that up at a local pharmacy. They open up and they go into the nebulizer machine. You can buy a nebulizer online, and sometimes your doctor can prescribe one. Lastly, there's what's called a spacer. Essentially, you put the albuterol device at the end of this little tube. When you pump it, the tube aerosolizes the gas inside, so the gas medication remains inside the tube. All you got to do is create negative pressure to get it out. So what this kiddo will do is he'll take about 5 normal breaths after this has been pressed and the medication's in the tube. Those 5 normal breaths will suck in the medication, and he took it without having to coordinate the pump and the spray and all that good stuff. Sometimes, like myself, some adults have a hard time coordinating this, so I would rather use a spacer, and I find a lot of times when inhalers don't work, the spacer makes it work. Now, albuterol is not the best medication or the best inhaler for asthma, but it's the best for short-term use as needed. So if you find that you have to reach for the albuterol every single day or even more than 2 times a week, or you feel like you're starting to wheeze or go into an asthma exacerbation, albuterol is not sufficient. It's only a short-term measure, so you should see an allergist for that. Or a pulmonologist. Okay, hope that makes sense and hope that helps.